Welcome to the channel. Today we'll discuss a different case scenario which is about a burnt lady. Here is our MCQ. A 30-year-old woman is admitted following a house fire. She has no obvious injuries except for some partial thickness burning to her back and legs. On initial assessment, she appears confused and Glasgow Coma Scale score is 14 and complaints of nausea and headache. Her blood pressure is 165 by 110, pulse rate is 105 and respiratory rate is 23. Oxygen saturation is 98 on room air. Arterial blood gases reveal respiratory alkalosis and a normal PO2. So we are asked about what is the next step of management. A. High flow oxygen via non-breathable mask. B. Intubate and ventilate. C. CT head scan, D. Fast scan of the abdomen, and finally 100% oxygen via rebreathing bag. So this is a bit tricky question. We are given all the clues and we have to discover what's the diagnosis and thereby excluding answers one by one come to a final answer. So as usual, we'll identify the main keywords in the MCQ. Here I have highlighted our main keyword. She's a 30-year-old woman. It's a house fire, so it's an enclosed space. Confused, GCS is 14. Nausea, headache, these are all important keywords. Blood pressure is 165 by 110, which is quite increased. And pulse rate also increased, she is tachycardic. Respiratory rate is also increased, 23. But oxygen saturation is 98% on room air. Pay attention to this point, it's very important. And ABG reveal respiratory alkalosis, but a normal PO2. So what is the diagnosis of this case scenario? It's a house fire which is an enclosed space and confused. GCS is 14 out of 15 and complaining of nausea, headache, high blood pressure, respiratory alkalosis and a normal PO2. And also consider that saturation is 98%. So these are important clues and this is a case scenario of carbon monoxide poisoning. Features of carbon monoxide poisoning include headache in about 90% of cases, vertigo about 50%, nausea and vomiting in about 50%, and alteration in consciousness about 30%, subjective weakness in 20%. And other features of exposure to high concentrations of carbon monoxide are confusion, cardiac tachyarrhythmias, myocardial ischemia, neurological deficits such as hemi and monoplegia, cerebellar signs, akinetic mutism, coma, and also cherry red skin color produced when carboxyhemoglobin concentration exceeds about 20%, but this is rarely seen. So now we know the diagnosis. Now we have to get the answer. Now this is a quick algorithm to manage patients with carbon monoxide poisoning. First, you should seek expert advice and then should remove the patient from source of carbon monoxide. And then the most important next step is 100% oxygen from a tight fitting mask. We'll talk about it later. And then you should monitor carboxyhemoglobin levels and blood gases as well. Cerebral edema should be corrected with mannitol and dexamethasone if there is cerebral edema. And acid-base balance should be corrected and also you should provide patient with general supportive measures. Back to our MCQ. Carbon monoxide poisoning is a common consequence of being trapped in an enclosed space during a fire. It should be corrected in all patients with such a history as it is easily treated and failure to do so may have serious consequences. However, if confusion continues despite appropriate treatment or if there is evidence of head injury or focal neurology, further investigation such as CT scanning is needed. Carbon monoxide's affinity for hemoglobin is 240 times that of oxygen. Its half-life is 4 hours. So while the patient breathes room air, this is reduced to 40 minutes if appropriate oxygen therapy is given. And also keep in mind that symptoms depend on the percentage hemoglobin saturation by carbon monoxide. So regarding our answers, appropriate management is high flow oxygen via a non-rebreathable mask. This is correct. Intubation and ventilation is only rarely required. So this answer is excluded. CT head scan is needed as we discussed before if there is confusion or if any other features of focal neurology. But we will keep this answer aside because we asked about the next step of management. And also keep in mind that because of its high affinity for hemoglobin, carbon monoxide saturates hemoglobin at low partial pressures. Therefore, normal arterial partial pressure of oxygen does not exclude a high carbon monoxide saturation. So in our MCQ, saturation is given as 98%. So this does not exclude carbon monoxide poisoning, which is a high saturation. And also keep in mind that pulse oximetry does not differentiate between hemoglobin saturation with oxygen and that saturated with carbon monoxide. Therefore, saturations will appear normal. It's a very important point. Carboxyhemoglobin levels are used to confirm the diagnosis and some arterial blood gas machines are able to provide these. We'll discuss a bit about non-rebreathable mask. So a non-rebreathable mask is a medical device that helps deliver oxygen in emergency situations. You can see in this image, this consists of a face mask connected to a reservoir bag and that's filled with high concentration of oxygen. The reservoir bag is connected to an oxygen tank. This mask covers both the nose and mouth. And there's a one-way valve. It prevents exhaled air from re-entering the oxygen reservoir. So as this is a case scenario of carbon monoxide poisoning, it's very important to prevent exhaled air entering this oxygen reservoir. The answer is gives 100% oxygen via rebreathing bag. So what is a rebreather bag? A rebreather mask has a plastic reservoir bag, as you can see in this image, that saves 1/3 of a person's exhaled air while the rest of the air gets out via side ports covered with a one-way valve, and this allows the person to rebreathe some of the carbon dioxide or exhaled air, which acts as a way to stimulate breathing. So in our case scenario, as it's a case of carbon monoxide poisoning, we definitely don't want to carbon monoxide entering the respiratory system back again. So this answer is wrong. Fast scan of the abdomen to exclude any other injuries. Yes, this is needed, but it's not the next step of management. So the best answer here is high flow oxygen via non-rebreathable mask. A is our answer in this MCQ. I hope you understood this MCQ. If you like this video, please hit the like button and also don't forget to subscribe my YouTube channel for more important MCQs like this. We'll meet from another question.